High blood pressure, or hypertension, is the most common major health condition in the worldwide. It is one of the leading causes of heart attack, heart failure, stroke, kidney failure, and premature death. It also can damage parts of the circulatory system, including blood vessels in the heart, brain, eyes, and kidneys. Sometimes called the silent killer. So what is blood pressure? Blood pressure is the force that the blood exerts on the artery walls as the heart pumps it through the body. The standard way to measure blood pressure is in millimeters of mercury (mmHg). Each blood pressure measurement has two numbers. Number 1, systolic blood pressure. Number 2, diastolic blood pressure. For most people, a blood pressure of 120/80ths of a millimeter Hg or lower is considered healthy. Effects of high blood pressure: repeated blood pressure measurements that are more than 130/85ths of a millimeter Hg indicate a potential for problems, a greater risk of progressing to definite high blood pressure, and the need to have regular blood pressure checks. A measurement of 140 systolic or more, 90 diastolic or more, or both indicates high blood pressure, which requires treatment. High blood pressure forces the heart to work harder than it should to pump blood to distant tissues and organs. Like any muscle, the heart gets larger with pushing heavy weights. Eventually, the heart's pumping efficiency decreases when the muscle can no longer adapt to the excessive workload that the high blood pressure demands. When this occurs, the heart muscle may weaken and the heart can fail. High blood pressure increases the risk of having a stroke, which occurs when a blood vessel within the brain either ruptures or is blocked. How to treat high blood pressure? Fortunately for many people, high blood pressure is preventable. Even those who already have high blood pressure may be able to reduce the number and doses of medication by the following lifestyle modifications. Lose weight. If you are overweight, losing weight is the most effective non-drug method for lowering blood pressure. In some people, weight loss alone is sufficient to avoid the need for blood pressure medication. Exercise. Regular aerobic exercise such as walking or biking for 30 to 45 minutes most days of the week is a very effective means of lowering blood pressure. Limit alcohol. Excessive alcohol intake is a risk factor for high blood pressure and stroke. It also can interfere with the effects of blood pressure medications. Men who drink should limit their intake to no more than 2 drinks a day. Women should have no more than 1 drink daily. Do not smoke. Smoking is also a major risk factor for cardiovascular disease. Everyone, especially people with high blood pressure, needs to quit smoking or never start. Limit or avoid high sodium foods. A high intake of sodium in the diet increases blood pressure in some people. People with high blood pressure should limit their sodium intake to less than 2,400 milligrams. For more videos, please subscribe and support us.